Thank you very much. It's a pleasure to be here at this IOM workshop on the relationships between the brain, digestive system, and eating disorder. I want to thank the IOM for inviting me to participate. I think notwithstanding the fact that I'm a lawyer, probably the only one on the program, but I'm here really by virtue of my longstanding FDA background and history, which Eric noted. I tried to think of how to kind of set the stage for the discussion that we're about to have. And several kind of points in my background kind of came to my mind. The first was that some years ago, I had the opportunity and really privileged to be part of the development of what now became the Nutrition Facts Panel at the FDA. I think really one of FDA's iconic achievements. And one of the reporters who covered that story was a man named Phil Hiltz. He worked for the New York Times. I remember his story. It was top of the fold, top of the right, nothing better, you know. And he went on and wrote a book about the history of the FDA. And, you know, the FDA is a controversial agency. We used to say the problem is we get bad news, not good news, and bad news is controversial. But he said that the FDA hallmark of when FDA's rudder has been straight is when the agency sticks to science and to evidence. Science, of course, in making decision-making, and evidence in terms of collecting information if they ever have to take enforcement cases. And of course, much of the discussion seems to steer away from those. And I'm really pleased that the IOM is coming back to that anchor and saying, let's start with the science. Let's have a scientific discussion. It could be controversial. It can have different points of view, but we need to have it. I think we all, you know, owe gratitude to our First Lady, Michelle Obama, for really stimulating a national conversation on childhood obesity. You know, her let's move, you know, means more than just let's move around. It's also let's move our minds, let's move our thinking, let's figure out how to tackle something that's real. When you work at a place for a long time like I did, you have a lot of good mentors. You learn a lot of interesting things. And I remember one of the lessons I learned there, I was pulled aside and said, you know, Joe, and this was from somebody who had been in the military in the Korean War. So you can do your own math in terms of age and figure out the possibilities. And he said, you know, when I was recruited into the military, meaning I was drafted into the military for the Korean War, and that would have been the early 1950s, the number one reason for being rejected for military service in this country was malnutrition. He said today, which was roughly 2000 or so, 50 years later, the number one reason for being rejected from the military service is obesity. And when you think of that, and Eric just kind of referenced a second ago, you know, that's an enormous change to go from malnutrition to obesity. You know, a lot of that, you know, the positive part of that is that food is more plentiful and more affordable. And, you know, as a society, we have to be grateful for that. Nobody liked the days of malnutrition. That was not something that people celebrated, certainly. But somehow the pendulum always goes from one end to the other. And, you know, we seem to have fallen into the other end. When Mark McClellan became commissioner, which would have been maybe 2001, 2002 timeframe, he was a health economist, and he recognized that healthcare costs were driven so much by chronic disease, and that so much of chronic disease could be prevented or delayed by good eating habits. And he was fond of saying, I know because I heard him say it, you know, many, many times, that consumers can do more good for their health by making sound dietary decisions than by doing anything else. If you're relying on medications, you're already too late. You need to move to the prevention side of the curve. And in order to move to the prevention side of the curve, we have to start thinking in terms of, all right, what can we do? Now, a problem we all have, and we all have this, is that we all search for and like simple solutions. Simple solutions are wonderful because they're simple, and in theory, they're solutions. I remember when we first worked on a nutrition facts panel, there was a Surgeon General's report that really labeled fat as the evil. And so if you go and look at any package still today, you'll see calories from fat, you'll see total fat, you'll see saturated fat. On some products, you'll see unsaturated fat, but fat was the evil. And what would happen was a lot of companies would go and reformulate into lower fat products. There was a low fat craze. And the problem was that low fat foods tended to have high sugar. And so people, I remember a young woman in the office would say, I'm gaining weight and I'm eating all this low fat food. And the answer was, read the label. You got to read the whole label. You can't read one part of the label. And so the industry moved away from that. Of course, then we had the low carb craze. Now we're into gluten-free. Everybody wants to have one single thing. And yet, if there's anything I've learned over the years about nutrition, and I'm probably the least expert person in the room, so you all know this better than me, it's incredibly complex. Certainly when I go up every year and speak at Ferg Clydesdale's course up at UMass, that's one of the things that comes through clearly in that class, that this is a complex matrix. It's not easy to solve. But nevertheless, it's important. We need to try to get our hands around it. And so that kind of brings us to today's speakers and today's session, which is the idea is out there, is food addictive? Is there something, is that what's caused? It's not plentifulness and it's not affordability. It is that there is something in the food supply that is somehow making people crave and want and eat more and more and more and more and more. That idea is out there. I certainly didn't create it. I don't even know if it's true or not. But nevertheless, the Food Forum wanted to air that discussion and coming back and learning, even if not citing Phil Hiltz, to come back to science. We could all have opinions. The opinions are wonderful, but they don't really solve much. They're great for bloggers. But this day and this room and this building is really about science. And so what we're going to do is we're going to hear two presentations of renowned and experienced and dedicated and professional scientific researchers who have devoted considerable time and attention in their professional lives to looking at these kinds of issues. We're first going to hear, and I'm going to introduce both at once, so I don't have to stand up and sit down and have that kind of awkward pause. And since they are kind of a set, if you will. Number one, first we're going to hear from Nicole Avena. Dr. Avena is a research psychologist and neuroscientist in the fields of nutrition, diet, and addiction. Dr. Avena presently holds a faculty position at the New York Obesity Research Center, sounds relevant, Columbia University up in New York City, and is also an adjunct assistant professor at the University of Florida Department of Psychiatry. She's already published over 60 scholarly journal articles on the topics related to diet, nutrition, and overeating. And so her presentation will focus on the hypothesis that food does have addictive qualities. All right? We're then going to turn to Peter Rogers, who is a professor of biological psychology at the School of Experimental Psychology at University of Bristol. So you'll detect just a small little accent to emphasize Bristol. Dr. Rogers' research is also highly relevant here, is on nutrition and behavior, and a large part of this research is concerned with how physiological, learned, and cognitive controls on appetite are integrated. The results are relevant to identifying the causes of obesity and disordered eating, and to understand food choice, food craving, and so-called food addiction. He also works on dietary effects on mood and cognition, which includes research on how food consumption affects alertness and attention, and studies of longer-term influences of diet on psychological health. So clearly our planning committee has picked two ideal candidates to share their thoughts with us this morning. First, please, let's have a warm welcome for Dr. Avena.